Doctors of Reddit, what is the biggest medical mystery you've solved? Not a huge mystery, but one that drove me nuts for 4 years as a dentist was this guy who had severe acid erosion on all his teeth, but one area in particular was super bad. I figured he had to be obsessively eating something acidic and chewing it with one side of his mouth. I would interrogate him at every single visit, and there were tons of visits because he was totally destroying his teeth, to figure out what the hell was causing it. I probably asked the guy 50 times over 4 years if he liked to eat sour candy. Always said, not really. One day we had a long appointment together, and I just decided to name every sour candy I could think of while I worked. Captive audience. When I said crybabies, he was like, I like those, they're so sour. Come to find out, he was eating 1 to 2 bags a day. Dude, what did you think I was asking about when I asked if you like to eat sour candy all of these years? It is a curse. I have it. Nowadays, specialists do diagnose endometriosis without a lap, at least in some places. It's a relatively new phenomenon, and likely depends on where you live if it counts as a full diagnosis, but I was diagnosed via high-resolution sonography, the sliding sign, and extensive anamnesis. Ultimately, I ended up having surgery anyway, since the specialist strongly recommended it to me for my particular experience with the disease. She was right, surgery basically gave me a new shot at a mostly normal life. Also, lots of endo doesn't present as strictly cycle-related at all. I was sent from GP to gastroenterologist, to gynecologist, useless, to psychiatrist, to GP, to gastro, to GP again, and was ultimately misdiagnosed by each respective discipline with psychosomatic pain, IBS, and diverticulitis I didn't have over the course of just IVR 2, 5 years of intensively pursuing a diagnosis for my experiences. Most of my symptoms were GI related, and I presented with chronic fatigue. In these said 5 years, I actually had oligomenorrhea due to intense levels of physical activity, leading me to not press them on the topic of endometriosis. Back then, I didn't know that oligomenorrhea can actually be an indicator for it. Ultimately, I was initially diagnosed by an internist who was my brother's superior and mentor at that time in a semi-private setting after my brother had me come by his station for abdominal sonography, as he was highly skeptical of the diverticulitis story for which I got strong, unnecessary, antibiotics. We chatted with my brother's mentor afterwards, and she immediately freaked out on my behalf because to her it was so obvious. She made sure I got a timely appointment in-house where I received proper care for the first time. This was actually how my endometriosis was diagnosed despite having symptoms for 17 years since my first cycle. I stayed cyclically coughing up blood, struggled to breathe, would start choking if I laid down flat, chest, arm, neck and back pain, etc. It took 2 years for the doctors to rule out all other possible causes. Beige, they concluded it was lung endometriosis and referred me to an endo specialist. Unfortunately, it still took me years of advocating for myself to finally get surgery, and by that point they had to remove part of the top and bottom of my right lung. I've had to have a hysterectomy to cure adenomyosis, 2 lap excision surgeries for extrapelvic endo, including deep infiltrating endo, bilateral oophorectomy, and 2 bilateral VATs. At this point, we're just trying to put off surgeries as long as we can, since mine returns within a year or less, despite excision surgery with top specialists. I made something up on the spot that saved a guy's life. Motorcycle crash. Dude comes in, agitated, breathing rapidly, has the I am dying look in his eyes. We intubate him for low oxygen levels, and it's just not working. The tube's in the right place, but now he has 2 massive pneumothoraxes, collapsed lungs, and with every breath he is pouring air out of the chest tubes I placed. Air is going in, but not making it into his lungs. There's an airway injury somewhere, and it's big. I tell my ED colleagues to get a bronchoscope ready because we're going to do the fastest CT ever and figure out what S injured. Edit. A bronchoscope is a tiny camera on the end of a long, maneuverable tube. Same concept as a colonoscopy scope, just smaller. About the thickness of a pencil. He barely survives being in the CT scanner. We get 1 pass through and speed him back to the ED so we can figure out the next step. As the CT images come across, it's worst case scenario. His trachea is completely severed, and forcing air to go through has created this large air-filled gap in his neck meat between the 2 ends of his windpipe. Every breath we force in there takes the path of least resistance, meaning into the chest cavity and out the draining chest tubes, but not into his lungs. So basically he He survived long enough for us to try and surgically fix it. But if we could just push the breathing tube down to the lower segment, we would be able to help him breathe again. So in a moment of inspiration, I tell my respiratory tech to set up the bronchoscope. I stick the scope in the breathing tube, like usual, and have the ED doc helping me pull the tube most of the way out. And there it was. Once the ET tube was pulled back, my bronchoscope was basically sitting in what felt like a giant cavern of neck meat, all stretched out from forcing so many breaths down the ET tube. And at the end of this cavern was the other end of his trachea. In reality, this cavern was probably 15 millimeters wide at the most, but I was locked on and drove that bronch straight down the middle and into the lower segment of his trachea. Once I had the scope in, I basically rammed it as far down into his lung as it would go, and the ED doc rammed the breathing tube over the bronch down into the lower segment. We pulled out the bronch and gave a few breaths. There was no leaking. His chest rose with each breath. His oxygen was back at 100 within 45 seconds. We got him up to the OR, and about 6 hours later had fixed him up, and he survived that night. The best feeling, though, is when a renowned otolaryngologist, whom we called in to help with the tracheal repair, asked how I got the tube down into the lower part of the trachea. I described what we had done in the ED, and he just goes, "How? That's not a thing." Edit for the sake of closure. Unfortunately, the story doesn't have a storybook ending. Without disclosing too much, the trauma to his neck also caused injuries to the carotid arteries on both sides, which caused blood clots to form in the arteries, which then broke off and showered into his brain over the next few days, giving him a whole bunch of small to medium strokes. Not completely brain dead, but enough that he'd never really recover neurologically, and if he ever woke up, he would probably end up bedbound for life. His family decided that wouldn't be acceptable quality of life and opted with withdraw life support and make him an organ donor. So while ultimately his story ends a few days after this event, his gift of his organs gave new life to at least 3 other people. Sucks that my best story ends this way, but I choose to see it as saving lives by proxy. I am an anesthesiologist. What you did was incredibly risky and could have made things worse. But not worse than dead. You sure as shit saved his life with some out-of-the-box thinking. Respect Bruta. I would expect the distal segment of the severed trachea would have suffered significant collapse and distortion with the creation of that pressurized compartment after PPV, even with cartilaginous support of the trachea. Also, the view I imagine must have been challenging, given inevitable bleeding into the aforementioned cavern. But maybe the air escaping into it helped prop it open. Honestly, mostly impressed he got to CT before coding, and someone would try to have his chest clamshelled open looking for the wrong problem. I feel like my institution often defers to he won, make it to radiology, send to OR. Anywho, nice. Your colleague definitely tells this as one, his go-to that broken_caster is crazy, but great stories in case you were wondering. I'm no doctor either, but my guess is that under normal circumstances, this sort of maneuver is just something that creates way too much risk to the patient because of IDK or anatomy modern tech combination. i.e., at the end of the day, it's probably not as simple as thing that can go into the lung can have a breathing tube taped to it, but the guy was clearly about to die anyway, so the OP went for it because 99 chance of the patient dying is still better than 100 guarantee of the patient dying. Diagnosed lupus cerebritis in a patient who was basically comatose after being on ECT for depression for a couple of years. I think she still had some underlying psych issues, but improved significantly after starting high-dose steroids. I was consulted as a resident on the ID service and noted the patient had persistent proteinuria and had been seen repeatedly for joint pains. My attending said we should sign off after the lumbar puncture was negative for infection, but I convinced him to let me order lupus labs before we signed off. Lupus cerebritis patient here. Multiple flares when I was 30, along with transverse myelitis. Doc finally figured it out between episodes when I went to an air show that summer. Feeling good when I left the house, very sick by the time I headed home. At an appointment that week, neurologist and I were chatting. He was very interested in aviation, so I showed him a cool photo from the air show. My husband happened to have gotten my face in the photo, and there I was with a great big butterfly rash across my face. I had attributed these rashes to me being the ad, with super sensitive skin. He recognized the rash and I had the lupus diagnosis within a week. The treatment made an immediate difference, thankfully. I'm a medical librarian. I had a surgeon call me about a patient she was completely stumped over. He'd had a device installed, but it needed to be replaced. The problem was the location. If she tried to remove it, he would have hemorrhaged. If she left it in place, he would have died slowly. Did a bunch of research, even called the device maker and spoke to them, finally found a tiny bit of a thread online, which eventually led to a YouTube video of the exact procedure she needed, and she was able to remove the device successfully. Not a doctor, but a genetic counselor who works in pediatric oncology, and it's less of a, what could this be? And more of a trust your gut situation. I saw an infant with a brain tumor who I was originally told had no family history of cancer, but upon talking to mom actually had breast cancer in her 20s, and her mother had a rare sarcoma and died in her 20s. Moreover, all of their maternal relatives had cancer at young ages. Interestingly, all genetic and tumor testing for both the infant and their mom was negative thus far. Usually, in that case, we say we don't know every cause for cancer yet and leave it at that. But the plot twist of the family history was extremely suspicious for one particular cancer predisposition syndrome, so I couldn't, in good faith, just end things there. I ordered a single gene test on a whole genome platform, which sequences far deeper into the gene than any other test does. Labs don't sequence that far because it's extremely rare to find anything there. In the intron, which scientists used to believe was junk DNA because introns don't get translated into protein. Sure enough, test identified a mutation deep within the intron of this gene. It's absolutely the explanation for the childless brain tumor and his family history of cancer. Certainly a devastating result, as this cancer syndrome is associated with a 100 lifetime risk for cancer of almost any type you can think of. It's called Li-Fraumeni syndrome if you read curious. However, I'm so grateful to finally have an answer for this family, because we can ultimately pursue intensive surveillance for positive relatives that will quite literally be life-saving. And of course, this fuels my paranoia of, is a negative ever truly negative, and intensifies my desire to dig deeper for these kids. Li-Fraumeni syndrome. My first thought after your first paragraph. For others reading, cancer is usually a result of a combination of genetic mutations. Either genes get turned on and make the cell divide too much, oncogenes, or genes get turned off and no longer act to prevent cancer, tumor suppressor genes. One of the most significant tumor suppressor genes is TP53. This gene is faulty in a vast majority of malignant tumors. In Li-Fraumeni, TP53 is faulty at a fundamental level, in every cell in your body. Every one of your cells is already 50 of the way to being cancer. So these people get lots of cancers at a really young age. Shout out to the doctor who recognized that my toddler had leukemia. She had an ear infection with a low-grade fever that her PCP had treated with antibiotics. A week later, we took her to urgent care because she still had the fever whenever Tylenol wore off. The infection was gone, but she had been developing a lot of bruises in the weeks prior. Her PCP had dismissed the bruising when I asked if it was something to worry about. Some kids just bruise a lot. But the doctor at urgent care noticed she had bruises on her back and sent us straight to the ER for a CBC. We are 9 months into treatment and doing quite well now thanks to her. A cool call I had as a paramedic many years ago immediately annoyed my partner and I. 20-something-year-old male woke up with nausea and vomiting Sunday morning in a neighborhood that is known for young people partying. The call note said there was a small amount of blood in the vomit, so it got up triage to paramedics responding. We arrive and are met by the patient's girlfriend, who is freaked out but guides us to our patient, who is white as a sheet, drenched in sweat, vomiting all but pure blood into a trash can that is already pretty full of blood. We start our assessment and treatment, and he has a vague medical history. He has always had digestive issues and has to eat a diet with extremely low fat. He has chronic diarrhea and really bad hemorrhoids. We ask about what he got up to last night and if he was partying. He says no, he can't have more than a beer under any circumstances, or he's a mess for days on end. He smoked a little weed, but not more than usual, and he smoked from the same bag earlier and was fine. He has never thrown up blood before. He never done more than go to an urgent care for his issues before, as he didn't have insurance. Obviously, he has an upper GI bleed, but something clicked in my caveman brain and realized exactly what was happening. His liver was screaming for help. Can't he digest fat? Can't he process alcohol? And what seemed like an innocuous comment was the key to the whole thing: his hemorrhoids. If the circulation through your liver gets backed up, it causes pressure in the blood vessels that come in and out to build up. If enough pressure builds up, the veins in your butthole balloon out, causing a hemorrhoid. If that pressure goes north, you can get esophageal varices, which are essentially the same thing as hemorrhoids, but in your throat. They can rupture and bleed like an absolute son of a bitch. Despite our efforts, he had lost a ton of blood and rapidly got worse. Upon arrival into the critical section of the ER, he painted one of their walls, passed out, and needed to be intubated and given many blood transfusions. The attending head doc in the ER had always been an aloof dickhead who didn't play well with nurses nor EMS, but after the dude's liver labs came back and we were back later in the day with another patient, he pulled me aside to be like, "What exactly is the scope of your guys' training? That was crazy that you caught that." I reflected on that moment for the rest of my career, during which I felt like an absolute moron about 90 of the time. Bro, as someone who has spent years in and out of hospitals with my wife with more medical issues than most, it is extremely rare for EMS or nurses to speak up and try to be heard. Tons of them have been conditioned to stay in their lane and just let the doctor handle all of the thinking. You are likely a hero in ways you haven't noticed. A nurse is responsible for my wife being not only alive, but a miracle recovery story from a severe TBI that put her in a coma. Doctors caused the TBI with negligent communication and told me to say my goodbyes to her. That nurse spoke up and voiced another option when nobody else would. "You fucking rock, dude." A paramedic caught a massive DVT that would almost certainly have killed me one way or another because he listened to me when I insisted something was wrong with my leg after a knee surgery. The only symptom I really had was swelling in my leg and foot that became worse as the day went on until I could barely move it or walk, which went almost completely away overnight. This was 6 weeks post-knee reconstruction after an ACL-LCL tear with my leg in a brace immobilizer. The doctors at urgent care and ER kept swearing it was just swelling from the surgery, probably because I was going in earlier in the day when it wasn't as bad. I finally ended up going in late one night when I was in so much pain I couldn't sleep, and my right leg was 2 to 3x the size of the left. The paramedic took a look at it, poked at my foot, I guess to try to get a pulse, and turned to his partner to say, "We need to get her in now." When we got to the ER, he would not leave the doctor alone until they agreed to do an ultrasound, at which point they found that pretty much the entire length of the main blood vessels and almost all of the smaller ones in that leg were pretty close to completely blocked, and I was in immediate danger of a PE. They had me admitted and on clotbusters and heparin 5 minutes later. Paramedics are cool, keep up the good work, my guy. On a much lesser level, my last ER trip, I was shaking uncontrollably and freezing cold for hours in triage. When they finally got to me, the doctor came in and spoke to my husband for all of 5 minutes, diagnosed me with an anxiety attack, ordered meds, and went on his way. A nurse came in to check my vitals and asked what the doctor said it was. When I told her, she said, "You don't look like you're having an anxiety attack." Came back 20 minutes later, drew blood, and it was hypoglycemia. My levels were 52 milligrams DL. That nurse saved my life. Psychiatrist here. In residency, I was moonlighting at a standalone psych ER. A man who didn't speak English was brought in by emergency services for psychosis. With some interpreter help, we were able to identify he was from Bhutan and that he had been a freedom fighter. But the interpreter said that he spoke very little that was comprehensible. I noticed some tattoos that seemed amateur and possibly from his time in combat. It dawned on me he could have hepatic encephalopathy from Hep C. I arranged transfer to a medical ER. They were pretty upset with me about it. To their credit, they called back later that night to confirm I was correct, leading to a plan of appropriate medical care instead of inappropriate psychiatric care. This story touches me. I had a carotid artery tear that caused a stroke in my basal ganglia when I was 48. It wasn't a common presentation for a stroke. When I showed psych symptoms, I was labeled as having anxiety and discharged. Despite having plenty physical symptoms, abnormal labs, and abnormal imaging, I kept being dismissed. In the days and weeks following the stroke, I had developed an inflammatory response that impacted multiple organs. But I also had the worst anxiety I have ever experienced and frankly, seen in anyone. I was utterly terrified. The stroke activated the fight or flight part of my brain. It also caused pressure on my pituitary gland that led to a hormonal nightmare. I presented at the ER about 15 times and was inpatient 3. I told them it was something systemic and that my heart wasn't right. They kept telling me my anxiety was causing that. Anyway, if they really thought my anxiety was that bad, no serious psych history, then it was outright cruel to not treat it and get psych involved. Instead, they threatened me with a psych consult in a way that scared me. I was afraid of losing what little control I had, because despite being extremely confused and terrified, I knew something was physically wrong with me. I finally gave up hope. As a nurse, I figured out that I was having some kind of inflammation from something and started taking a steroid I had at home. That helped tremendously, but it took almost 5 years to find out what happened. I had a CT scan for something unrelated. In those 5 years, I lost family and friends because of my behavior changes. They were attributed to a character flaw and not recovering from brain damage. I also developed severe PTSD. Anyway, I deeply appreciate when caregivers rule out medical causes before diagnosing psych. Sometimes it's a symptom, not a diagnosis. Thank you. Oh wow, I'm so sorry that happened to you. The way psychiatry and medicine are siloed apart is an abomination when you think about it. And the nature of this pushes docs to think about them separately unless we are determined not to. I'd like to think that, as a nurse, your claims of something feeling wrong would be given extra consideration. Anyone who says this should be attended to closely, but you have a greater body of medical experience than most. I have many criticisms of my field and our system of care. I find that listening and actually caring goes a long way towards helping others, so it angers me to see colleagues who cannot or do not exert the effort and empathy that could lead to relief for the patients under their care. I'll step off my soapbox before I rant too long. I hope you re-feeling close to your old self and wish you well. NAD, but saw this. Patient came with constant hiccuping that wouldn't go away and dizziness spells. Initially, they were told it was just hiccups and should go away, but it didn't, and it was constant. Their primary care and urgent care physicians kind of blew them off and racked it up to nothing. They wound up going to the emergency room, who did a chest x-ray to rule out some kind of weird origin. So anyways, this patient had a permanent pacemaker placed some months ago. Chest x-ray showed the wire that goes into the heart to pace them had punctured the heart, gone outside of it, and looped its way around to the other side and was sitting partially against the vagus nerve. Their constant hiccups were from their dislodged pacemaker, causing pulsations to the nerve that controls their heart rate and breathing. They wound up having the troubled lead wire removed and replaced, and their hiccups and dizziness were fixed. Not the biggest medical mystery I have solved, but the first that comes to mind. I once had a 5-year kid come into an urgent care I was moonlighting in for cold symptoms. We talked about upper respiratory infections, supportive care, etc. Examined the kid, was about to leave when I noticed one nostril was putting out purulent drainage and the other was clear. I asked mom about it and she told me that nostril always drained. She was told it was allergies. You don't get allergies in just one nostril. I also noticed that the room smelled foul. This happens a lot, so it was not that remarkable. However, it was particularly bad in this case. Any physician reading already knows what this is, I bet. So I got a little bulb syringe and suctioned out as much as I could. Saw something in there. Couldn't really tell with all the mucus, but grabbed some alligator forceps and reached in. Pulled out a 3-inch chunk of wood. Mom was all amped up and emotional, started crying. Apparently, he had this problem for a few years, saw multiple doctors, and no one had fixed his problem, and because of the smell from the festering foreign body, he had been relentlessly made fun of at school. It was such a small thing for me, 15 minutes extra. The other case is not mine. It was a story a EM physician told me when I was a medical student. Had an obese woman come in with chest pain. They did all the tests and nothing came back. Finally, someone worked up the courage to do a PANIS exam under the fat pads, and this person had a wrapped McDonald's hamburger stuck up in the fat roll on her chest, and it had made a terrible dermatitis and pain. Another interesting one. Kid with autism, severe food restrictions, came in with bleeding gums and tons of constitutional symptoms, turned out to be scurvy. That was when I was a resident. Since then I have come to find this is not so uncommon, but it sure got me excited at the time. There are so many more interesting cases, but I am getting tired of typing. This thread was nice though, reminded me that my job isn't entirely tedious paperwork. Not a doctor, but a nurse. I had a patient that had been struggling to find a medication to help with her anxiety and depression. After a couple of years of trial and error, we found a med and dosage that worked extremely well for her. Time goes by, and she suddenly starts having symptoms again. She said, "I don't know what has happened. The meds were working so well, and now I feel just as bad as I did before I started medication." We spent several calls and visits going over every single thing, just grasping at straws. Has your pill manufacturer changed? Do the pills look different? Has your diet changed? Increased stress? Exercising more? Anything? Finally, I asked her if she had recently started any new medications prescribed by another practice, and she suddenly remembers I started metformin about 6 weeks ago. I think to myself, "That's it!" I asked her. Not to be gross, but are you having a lot of diarrhea since you started the metformin? She goes, "Yes, I am pooping several times a day. I can keep anything in." I then explained to her that the problem was she wasn't absorbing her depression meds, she was pooping them out. So not only was she not getting the benefit from the meds, she had been going through med withdrawals too. She talked to the doctor who started her on the metformin, and he switched her to metformin ER and changed the timing of when she took both meds. 2 months later, she was back to feeling good again. My kid was born with a rare lung disorder called congenital lobar emphysema. At the time, less than 50 cases had been seen in the world. Son shouldn't have lived past 2 weeks, but our pediatrician finally diagnosed it at age 5 months. Son had surgery, left upper lobectomy. The following year, our pediatrician was at a huge conference with around 700 MDs in attendance, and the speaker threw out the symptoms for my kid's disorder. Only 3 hands in the room raised to acknowledge they knew the diagnosis, and one was our pediatrician. Not me, but my attending. We had an older guy with new severe hip pain, but his X-ray and MRI was normal. Things were just off and she felt like there was more going on. We got an MRI of his spine and lo and behold, he had a huge honking spinal abscess. Most of the time, you would expect to see weakness or sensory changes with a spinal abscess. He had none of that. We imaged his whole spine and found a couple more spots of infection. So we imaged his brain. Big old abscess. We also got a heart ultrasound echo that ended up showing a massive infection sitting on one of his heart valves. He had literally 0 symptoms except this sudden onset hip pain. Long story short, we think his bad diverticulitis let some bacteria into his blood, and he was unlucky enough to have it seed his heart valve. He ended up doing great with a truckload of antibiotics. How long ago did that happen? Do you have any track of that guy? I feel like it might not be fully resolved because that is really unusual for otherwise somehow a healthy person to have such massive dissemination of infection. I've only seen that in polymorbid or severely immunocompromised patients. But it reminded me of a guy that came for lower back pain. He tried physiotherapy on his own, which helped for a few hours, but it came back. Other than that, he felt normal. Spine and hip movements were normal, and the pain wasn't palpable, nor in his back or abdomen, only slightly in his gluteal region. But he looked a bit paler than usual, so I did POCT-CRP, which was normal. I almost sent him home with myorelaxantium and painkiller and physiotherapy recommendations, but he didn't really look like himself. Perks of being GP, so you know how your patients look when they are well. I sent him to get US of abdomen, and he had ABSCES and iliopsoas muscle, which they drained on spot. It was lucky that the physician performing US was able to do that. Not a doctor, but giving kudos to my daughter's doctor. At age 5, she had a tummy ache that seemed more than normal, so we took her to urgent care. They sent her home and thought it was a rough stomach bug. She wakes up the next morning and doesn't want to move. From the time I could feel her kick until she came out, she was constantly on the go, so we took her to ER. Doctor tested her on heel drop test, suspecting appendicitis, but she passed. So he said he wanted to run a blood test because he had a suspicion but was unusual. Blood test comes back. Her pancreatic enzymes, I think, were off the charts, which is what doctor had suspected, pancreatitis. She spent 5 days in one of the best children's hospitals in Colorado. No underlying cause, which is extremely rare for a child, 2 to 10 cases per 100,000 children, and made a full recovery. How that doctor suspected it, I have no clue, but very grateful for them. On a side note, she was transferred to the Children's Hospital main campus, which is also a teaching hospital, and it was fascinating to see the process. Because it was such an unusual case, we had anywhere from 3 to 5 residents come in each morning, learning about her, asking the head doctor questions, etc. Our last day, the department head came in to talk to us about how unusual her case was, that we would likely never find a cause, and how difficult that may be going forward, but such is life sometimes. She is now 12 going on 18 as it seems and hasn't had a problem since. Not the doc, but I was taking care of a patient that was hospitalized for multiple days because of crazy swings in her blood glucose. The docs couldn't figure out why 1 minute should be cruising well over 350 and climbing, and 20 minutes later it would crash into the 40s. She was nothing by mouth for reasons I don't recall, possibly a gastro infection, so we were pumping IV dextrose multiple times a shift to keep her alive. We were literally down to our last vial, including robbing the crash cart on my unit, and the ER, and I was freaking out because I was working alone that night. It was a rinky-dink rural outpost hospital, 1 doc in the ER on call as needed for my unit. Overnight, no real support besides calling EMS to transport to a larger hospital over an hour away, and I was afraid of losing my patient. In between this patient's crises and other patient care, I did a deep dive on the interwebs and found a research paper that discussed how some diabetics respond that way to certain classes of antibiotics. I let the hospitalist know in the AM and provided the link to the paper, but never got a response. I was off the next night, and the patient was gone when I came back for my next shift. I was afraid she died, but was informed by the outgoing shift that she discharged home because our hospitalist figured out it was the antibiotic causing the chaos and switched meds, and immediately her blood glucose stabilized. And with the new antibiotic, the infection was brought under control. I am not a doctor, but one saved my life by a simple handshake. I was in hospital with gallstones, I was prepared for surgery, saw my surgical team, etc. All good, we are taking you up for surgery. I felt absolutely rubbish, but put it down to anxiety and the pain from the gallstones. The doctor was in the room to see the woman next to me. He was Irish, and I am Irish both outside Ireland, so we picked up on the accent and had a little chat, as you do. As he was leaving, he went to shake my hand. He walked away and came back, questioning me that my hand was extremely sweaty. I explained that I have anxiety and it was going off, but he was not convinced. Thanks to him putting up an argument that my surgery should not go ahead and I need scans. My scan was canceled 3 times, but he kept on pushing it through. I was diagnosed with multiple bilateral PES. Wow, when I had my PES, it started out as shoulder pain and an ache in my side. I went to my GP at the time, and he said it could just be a pulled muscle but wasn't sure. He gave me muscle relaxers and said if it's not a pulled muscle, the pills will just make me sleepy. But he said if the pains get worse to go to the ER. Well, I slept for the rest of the day and then woke up that night with excruciating pain in my side when I laid down. It was still painful without laying down, but laying down made it so much worse. I get to the ER and they do an X-ray of my abdomen. They don't see anything, and because of where the pain was, they thought it was my gallbladder. So they did gallbladder ultrasound. Laying back for that was so painful. The tech kept telling me to lay still, but I just couldn't T. She eventually got a good enough view and determined it wasn't my gallbladder. I'm taken back to the ER room they had me in for what felt like forever, when the doctor finally comes in and says they want to do a CT scan of my abdomen to find the source of the pain. So I have to try to lay back and be still for that. Again, so freaking painful. Then I'm taken back to the room to wait. Then the doctor comes in and says they saw something in the upper corner of the scan, in my lungs, and want to do another CT scan, but this time of my lungs. So I have to do all of that over again, and finally they realize it SAPE. Then I'm admitted to the hospital and put in a real room, and they start me blood thinners and pain meds. I stayed there for 4 days. I don't know how many PES I had, or if it was in one or both lungs. I don't think anyone even told me that. Or I was in too much pain on a lot of pain meds and just don't remember. I do know I had pleurisy, and it was fucking awful. But I remember not realizing how big of a deal it was until I was Googling PES. Then I was like, WTF, I seriously could have died. Luckily, I don't have any genetic factors. It was most likely caused by the birth control pill I was on. I was on blood thinners for 4 months. That was almost 8 years ago. Every little pain or twinge in my side still gives me anxiety. I hope you're doing well. Obligatory, not a doctor, but my daughter was medevaced by helicopter to the nearest PICU at 5 weeks old for hypothermia and suspected sepsis. Even on antibiotics, she was getting worse. Full body MRI and CT showed nothing wrong. Blood work coming back fine. Vitals appeared to be fine, but she was becoming paralyzed and couldn't eat. She had to be placed on a ventilator. Genetic testing came back negative for Prader-Willi, Engelmann, and some others. Someone on her team suspected infant botulism and ran a fecal sample and sent it to the CDC. They had baby big botulism immunoglobulin flown in from California and then driven 2 hours to get to us, and once she received it, she started showing improvement. She ended up having type B infant botulism, the only case diagnosed that entire year in the United States, and she was only the 13th case of infant botulism in Minnesota ever. Without baby big, botulism is upwards of 85 fatal, but with the antitoxin, children typically have 100 recovery with no lasting side effects. I'm not sure if this is a mystery, but I connected the dots as a resident, 8-year-old kid that presents to ER with fever, SOB, and a small lower leg wound after falling while running 2 days before. He also was wanting to walk much due to pain from his leg. Everyone had assumed his wound, but when forced to ambulate, he had a bad limp. I was in last year of MedPeds residency. I presented the patient as fever from a septic hip to 2 from his leg wound. Shortness of breath and fever from pulmonary embolism also. This was my guess before labs and CT based on physical exam. In the end, I was right about everything. I was just trying to be a smartass because I had a good relationship with the attending, and PE in kids is way less common than adults, so I thought I would be more obnoxious throwing in the PE part. It was humbling because I was just being obnoxious, and it made me think about what I've missed before not turning over rocks. Similar situation years later with an elderly woman with anemia, GI bleeds, and aortic stenosis that my partner ran by me. She had been scoped by GI and been to heme with negative anemia workup. Cards didn't he think she warranted valve replacement. Patient kept getting passed and my partner was getting frustrated. Being as ass, I asked if anyone had considered Hades syndrome. I told him, put that in your note and send her back to cards. She underwent valve replacement. No more bleeding, no more anemia. This happened to me, except I was the patient. When I was 5, I started getting these awful ear infections. All the time, relentless. The instant I'd finish the antibiotics, another ear infection would flare up. At the same time, I developed a limp. I actually remember the pain in my left hip. It was such a deep, profound pain where every step was agonizing. But because of the constant ear infections, pain was nothing new, so I didn't complain. My parents thought that because I was learning to ride a bike, I must have fallen and hurt my leg. That went on for about a month, until one day I just couldn't get up. Couldn't walk, couldn't even sit up, had a crazy high fever. My dad drove me to the ER, and I remember feeling every bump on the road. They couldn't figure out what was wrong with me, were discussing airlifting me to another hospital, when suddenly one of the doctors put the pieces together. Apparently, she had just finished a fellowship at another hospital, where she saw a similar case in a child with septic hip. They theorized that my ear infections gained so much antibiotic resistance and then traveled in my body, nesting in my hip. One surgery, a drainage tube in my hip, a week in the hospital, and several months on crutches later, and I was back to normal. My ear infections stopped after that. And when the weather changes, I still feel the pain in my hip. Not a doctor, but I diagnosed a coworker's epilepsy once. We worked at a restaurant and she was notorious for being insanely clumsy and tripping, nearly falling at least 5 times a shift. I don't remember what raised my suspicions, but I asked her what she felt whenever she fell. She said it was like everything would just go white for a second and she'd lose any control of her body, but didn't think it was serious because it only lasted a second. I told her those sounded like seizures, and though I didn't know the technical name, I knew not all seizures were the big ones like you see on TV and in movies. I convinced her to at least ask her doctor about it, if only for my peace of mind. A week later, I got a huge hug and a gift basket with her telling me I was bang on the money, and according to the doctor, they'd just managed to catch it and start treatment before there was any permanent damage. This was years ago, but I'm still proud of that one. I'm giving myself away with this, shouting out my former pulmonologist who solved my medical case, at least enough that I know the why now. I suffer from recurrent spontaneous pneumothorax. I've had 10 confirmed collapses in about 7 years, but against all statistical odds, only on my left lung. I'm a woman. 37 years old, started when I was 30. I am rail thin, but only 5 feet 4. All this to say, I do not fit the criteria for who this condition impacts. I was tested for every connective tissue disorder that could be remotely related, as I do have other signs that might suggest one, but alas, all negative, even after repeat testing. I had already had a mechanical pleurodesis by the time he was my pulmo. When I needed another pleurodesis, he was part of my team and got my records, and told me what my previous surgeon could have, but never did. Apparently, the little sacs in my left lung are deformed in an almost diamond shape, making them prone to tearing. The odd thing, though, is that my right lung is more elongated oval and not diamond, so it hasn't torn and probably won't. I'm probably explaining this poorly. He also recognized I had untreated asthma my whole life and told me the scarring from my repeat collapses had given me COPD. He got me on meds for both. I've only had one minor collapse, not even a tube needed, these last 2 years, since he cared enough to figure out the reason, instead of throw his hands up like literally so many other doctors did the 5 years before I found him. And then he left the practice super suddenly earlier this year, and I'm heartbroken because I don't know I'll trust another doctor with my life more. Fuck it. Dr. P, if you ever come across this, thank you. Because of you, I was able to work again. Because of you, I got to enjoy physical activities with my kids again. My family and I never got to truly thank you for how much you did for me, maybe without even realizing it. I can breathe again, Dr. P. I don't think you'll ever know the hugely positive impact you made on my life by just caring, and I really wish I got to tell you that. If you read this, hey doc, Miss Ya. One case that mystified everyone in the hospital related to a schizophrenic man with a headache. He was there for 2 weeks telling people about the headache before he got to my mental health unit. The whole time, he told everyone about how he shot himself in the head with a crossbow to remove the microchip in his brain. The first time I saw him, I was like, yeah, let's check that out. I ordered a head x-ray, which is rare because it gives little more extra information than just looking at his head, and it found a crossbow bolt embedded in his skull. Surgery was called to actually fix his headache. IDK. Maybe it's not that much of a mystery, but somehow it stumped like a half dozen other doctors for a couple weeks. Underscore. Had a patient who had been dismissed repeatedly as having low appetite and weight loss from depression. Otherwise, well, with pretty unremarkable labs or vital signs. No other symptoms. Spent some time chatting with her, and she was a beloved home cook in her community. But suddenly, she couldn't stand the smell or taste of the spices she normally used. Just felt off to me, and ended up diagnosing adrenal insufficiency. Appetite came back within days of the proper meds. Definitely not anywhere close to the rarest thing I've diagnosed, but one of the ones I'm most proud of. I was on a night shift when one of my junior colleagues called me for a puzzling patient and to come and help him out. This man would be lying down and be fine, oxygen saturation's 99 without any supplemental oxygen. And as he sat up in bed, his SATs went to the high 70s. Read, very bad. So the thinking was, oh, is this an infection, a pulmonary embolism, etc., etc. It had been going on for a while and no one seemed to know what it was. Reading the notes, lots of people had seen the patient and done various scans and got the lung specialists involved, but nothing was showing up. Out of pure luck, I had seen a case like this at a massive teaching hospital I'd worked at. This sign is called platypnea orthodeoxia. When I first saw it, we were all puzzled, but because it was so weird and unique, it stuck. That patient had the same issue as the one I saw on this night shift, and ended up having a reasonably large hole in his heart, which was repaired and his symptoms finished. Obviously, I immediately thought, surely this can't be that. It's a super rare diagnosis. But I kept sitting this man, then lying him down, and kept seeing the oxygen levels wildly fluctuate with exact correlation to his posture. So of course I thought, mate, fuck it. Let's get cardiology involved. Get them to scan for a hole in the heart, PFO. Lo and behold, there was one, and it was repaired and his symptoms went away. No one congratulated me or anything, but I was absolutely buzzing that I caught that diagnosis when no one else could. This was during my intern year. I decided to check on her overnight because her HR was newly elevated on telly a couple days into her course after initial ABX were started, and she had been cruising. I was doing a physical exam, and I remember asking her to roll over in the bed so I could check CVAT or something, and I found a literal poop-filled 10cc syringe in her bed. Paged my senior to the bedside. My senior asked if it was okay if we looked in her travel bag for medrec purposes, and sure enough, it was full of syringes and needles. I work in dermatology. I had a patient who is experiencing delusions of parasitosis. They literally think they have bugs crawling on their skin. It's a somewhat common psychological disease we experience in dermatology, and most of the time, it is 100% psychiatric in nature. Patient reports that he swears that he got the bugs from a sexual partner. Physical exam on the genital area shows no abnormalities and he has no skin abnormalities. SOI, run an STD panel. Long story short, he has neurosyphilis, and I had to send him to the hospital infectious disease for some heavy doses of penicillin. Syphilis definitely has the reputation for being the great imitator. Not a doctor, but when I was working in ED as a nurse, I got a transfer from a smaller community hospital in our system. Guy was one of our cancer patients and had presented there with chest pain, and since their workup was negative, they sent him over thinking it must be treatment related. So I go in and start my assessment, open up his gown to do a 12 lead, and I'm like, sir, how long have you had this rash? I scoured the notes he was sent over with, and there was absolutely no mention of a rash, even though they did an EKG there as well. I found the ED-MD, who was a notorious hard ass, super unfriendly, and asked if he'd seen the patient yet, which he hadn't, and I told him, well, I think he's got shingles. He went in, checked him out, wrote a script, and off he went. I'm the patient here, and I have a few rare diagnoses, but I'll tell you the one with the more interesting story. See if you can guess the diagnosis before the end. It's an atypical presentation. At around 19, I began getting a lot of UTIs. Months later, I realized that I can't feel when my bladder is full. I go to a urogynecologist and do urodynamics testing that confirms the nerves to my bladder are indeed dead. I have a slight herniated disc, so it gets attributed to that. I develop really bad sciatica, and my feet would go numb. I wind up in pain every day with significant muscle spasms in my lower back and down my legs, which is typical for a herniated disc. One neurosurgeon wanted to operate, but when I got a second opinion, he explained that my herniation shouldn't be causing these symptoms because it's very slight. I get referred to PT, but PT seems to worsen my symptoms. They told me they could no longer help me and discharge me as a patient. Years go by, my pain and numbness only worsen. Finally, the pain spreads to my abdomen and reaches a point where I am bedbound almost all of the time. I just so happened to be seeing a reproductive endocrinologist for fertility issues at the time, and they just so happened to have one of the best endometriosis specialists on the East Coast on staff. She recommended a laparoscopy on a hunch, and she was right. We operate, and there was scar tissue everywhere I wake up with no more sciatica or muscle spasms or pain. That surgery completely changed my life. I had never had bad periods. I barely even cramped. I had sciatic endometriosis primarily, and if I wasn't seeing that exact reproductive endocrinologist, I may never have had it treated. Absolutely wild, but my first thought was endo. Your hint about it being an atypical presentation maybe sparked it. So many people think of endo as just bad cramps and heavy bleeding, but it's truly an invasive nightmare. Someone in another comment said they had a patient that was coughing up blood in sync with her menstrual cycle. Eventually figured out it was endo that had grown into the lungs. There's this idea that it's just around the uterus, but I think the actual definition is just tissue similar to uterine tissue that grows in areas it doesn't belong. Turns out those areas can sometimes be stuff like your lungs. Also, I imagine around the spine is a big one. Our vet diagnosed my blastomycosis. Our dog was diagnosed the same day. We were in his office because she was desperately ill, her eyeball nearly bulging out of her socket from pressure, and coughing. He x-rayed her chest, made her diagnosis, and happened to notice I was pale, my eye extremely irritated with a reddish hue to my iris, and coughing too. He sent me to the ER with a note to tell him to test me for blastomycosis while he did her eye removal surgery. He saved me and her that day. I had it in my eyes and lungs just like my dog did. We spent a year recovering together, edited for spelling issue. Not a doctor, but an EMT, I was called to the scene of a car accident. A man had crashed into a fence near a reservoir. He had vomited down the front of his shirt and had a large red mark on his forehead. The police were ready to arrest him for DUI and asked me to check him out. I asked him what had happened. He said he was on his way to pick up his son from school when an animal ran in front of him, causing him to swerve, hit a puddle, and skid into the fence. As he spoke, I could smell what seemed like alcohol on his breath. It was also around 7 p.m. on a sunny Sunday. In July, there was an TA puddle in sight, and there were no skid marks. His story didn't add up. I asked how much he had had to drink that day. He insisted he hadn't been drinking. I pressed a little, and he said, "I'm a Muslim, I do not touch alcohol." I noticed he was very broad-shouldered and about 6 feet 3 inches. I asked how much he weighed. He said 375 pounds. Then I asked if he was diabetic. He said no. Had he ever been tested? No, that S when it clicked. The alcohol smell wasn't tea alcohol at all. It was the fruity call sign of diabetic ketoacidosis. My patient was an undiagnosed diabetic who had likely passed out behind the wheel. That explained the crash and the breath, but what about the vomiting and bizarre story? While I was puzzling that out, the man asked to go to a small local hospital. Normally a reasonable request, unless I have a trauma patient. I looked at the red mark on his forehead and decided to check his pupils, and that S when alarms went off. With help from the police, we loaded him into the ambulance and expedited transport to the nearest trauma center. En route, he complained of severe head pain, said he could feel his pulse pounding in his head, and then started screaming. His blood pressure was climbing dangerously higher and higher every time I checked it. When we arrived, the triage nurse tried to send him to general triage. I insisted he needed an immediate head court. She pushed back. I grabbed a doctor, explained the situation, and he ordered a rush court. As I suspected, the patient had a brain bleed. He went straight from CT into emergency surgery to stop the bleeding. It's probably the call I am most proud of. If I had done one thing differently, if the police had arrested him, if I'd taken him to the wrong hospital, if I hadn't argued for priority treatment, or if I hadn't taken the time to really talk to him, his chances would have been so much worse. he might not have survived. This young person comes into the ER in an ambulance, passed out. They are septic, fever, hypotension, tachycardia, and they are losing 2 organ systems at the time of presentation, kidneys and liver. They can't give a history because they are obtunded. They send this person to me, and, of course, don't help me with IV contrast because they don't have sufficient renal function. The images come out looking like vague gray mush, edema everywhere. I see 4 1 to 2 millimeters gas bubbles, 1 in the portal vein, 1 in a tributary of the superior mesenteric vein, and 2 next to the pubic symphysis. These gas bubbles do not belong there and are a grim prognosticator. I have to make some kind of wild guess because this person is close to death. I look closer and see erosions on the left pubic body. I call the surgeon and tell him to cut out the pubic symphysis, septic arthritis. I make the diagnosis in 20 minutes. They cut out the offending joint, and the patient walked out of the hospital 7 days later. Follow-up CT showed hundreds of liver abscesses from bacteremia. Those cleared with continued antibiotics. My coworker who read the follow-up CT came up to me and congratulated me on a brilliant diagnosis. It had been eroded or eaten away by arthritis that had gone septic. Op either saw it on imaging or noticed that this part of the body didn't look quite right to the naked eye. Op did mention finding 4 gas bubbles, 2 of which were in close proximity to the pubic symphysis. If the pubic bone was eroding, it might look a little caved in from the outside when the patient is lying down. Sepsis produces gas because essentially the part is rotting inside the body. Cave-in bubbles in the area. This is where the problem lies. When someone drowns and is not found for a while, they often sink for the first several days. More if it's cold water weather, especially if they have lower body fat. The process of decomposition produces gases, which in a drowning victim can remain trapped and cause the body to float. Same concept. The death of a single body part is producing gases in a living patient. I didn't solve it, but my daughter was too, and vomiting nonstop. I called the nurse line, concerned with the volume and frequency, as she had puked 15 times in the last 6 hours, and I swear it was everything she was nibbling, sipping on coming back up. They said if she throws up again, go into the ER and get her checked. She does, we do, and we do the 5-hour wait for them to tell us she has a stomach bug, give her Zofran, and give her a cracker and juice trial in the waiting room. 30 minutes go by, no puke. She was asleep in my lap. It was like 6:45 at that point. They send us home. When we get in the driveway, as I'm unbuckling her, it all comes back up. I called the ER back. They said wait a couple hours and come back at lunch if she's still puking. This didn't sit right with me, so we clean her up, put her back in the car, and drove 45 minutes to the Children's Hospital. The encounter there starts out very much the same. They ask about the last time she vomited on the way there, and say they'll get her something to go under her tongue to stop it. When I told them she's already had that at the other ER, both the nurse and the PA stop, turn, look at each other, and PA says we need imaging now. Turns out her intestines had been tying themselves in knots for the last 12 hours, and if we had waited, or if they hadn't looked further, there was a good chance there could have been tissue death, or worse. I'm so grateful they didn't brush it off as new mom being dramatic, or just a stomach bug. The fix was an air enema and more imaging, very thankful it didn't end up in surgery. Not a doctor, but my psychology degrees came in handy when a family member was discussing his brother's memory issues, featuring confabulation, and I correctly suggested Korsakoff's syndrome, similar symptoms to Alzheimer's, but most commonly found in alcoholics, which he was. I also saw various doctors about abdominal issues and got diagnosed incorrectly with various digestive disorders and medicated accordingly. I figured out on my own that it was gallstones, got an ultrasound privately, and finally forced my doctor to refer me to a surgeon. I experienced flu symptoms and later had a massive burst sensation in my eye and went blind in that eye for an hour or so, and it slowly went back to about 85 normal. I went to the doctor later out of concern for my eye and also mentioned the flu and fever symptoms I had about a day earlier. He sent me to the eye doctor and he told me there was some large inflammation on my optic nerve that caused the eye issue, but they had no idea what the original cause was. They asked a lot of questions but remained baffled and sent me home. I think I went back several times. About 4 days later, out of the blue, someone in the eye doctor's office did some sleuthing of my eye x-ray, I guess. I got a call from a medical assistant or nurse at the eye doctor's office, and she asked me just one question. Have you been around any cats that may have scratched you? Yes, several. I adopted some kittens, In fact, when she called, I had a kitten in my lap and it was playfully pawing me. The fever and the eye issue was caused by CDS, cat scratch disease. You get it from kitten scratches. Apparently, when it affects the optic nerve, it leaves a very distinctive star-shaped scar in your eye. That is the only way I can think of that she, or the eye doctor, figured it out. Not crazy mysterious, but the biggest impact. I was a psych intern rotating in FM. Rotating anywhere, as psych guarantees getting handed the patients the attending dreads seeing, for which they are usually quite grateful. Attending hands me the folder with the off-noted, "Oh, this one is perfect for you, 40s female." Described as anxious, dramatic, and attention-seeking, has been seeing this PCP for over a decade. CO, random stuff. I see the point. Who, CO over a decade of transient neurological symptoms that are intermittent and affect seemingly random areas of the body. Over time, she states that episodes happen more often, and she doesn't feel like she is bouncing back the same as prior. Also reported other history consistent with my suspected diagnosis. I go back to talk to attending, say I think we need to do a workup for MS. He rolls his eyes and says, "She got to you, huh?" Says that if this is what I truly think, and the point is willing to pay for it, go ahead and order workup. So I did. It ended up being the last week of that rotation, so I did not get to follow up with patient. A couple weeks later, I am on another rotation, but get a notification for a lab result. Since I ordered the entire workup, the results got sent to me as well as the attending. Workup positive for MS. This poor woman was dealing with untreated MS for over a decade. Her description of the symptoms would have been easy for even a first-year med student to put MS near the top of their differential. Still makes me angry. Not a doctor, but social worker. We can T-diagnose, but we can make recommendations to clients' patients that they be evaluated for XYZ diagnosis, especially in mental health. During the pandemic, I was doing brief intervention and general mental health services. A client was describing some really intense emotional reactions to certain sounds they encounter in their daily life, and that it was really challenging for them. The way the client was describing the reactions sounded to me like neurophysiological disorder, and not generalized anxiety or depression, but that's what they'd been diagnosed with. The client's doctor had been prescribing Ativan for years, but there had been no improvement in their reactions to these specific sounds. Googled the client's symptoms, and misophonia was the first hit. I read the descriptions and it fit exactly what they'd been describing. I had never heard of it, but read a couple of journal articles about diagnosis and treatment, and was convinced that I had to send the client some information and provide a referral to a specialist clinic in their area. This was all within about 2 hours of the initial consult. They wrote me back to say thanks and that they would check it out. Next video call was several weeks later. The client tells me that they went to the specialist and got a diagnosis of severe misophonia. They said that the clinic was very responsive and supportive and that they were getting treatment, which is mainly CBT anyway. They thanked me for validating their experience. I always felt great about that one, and it was such a simple effort on my end. ER doctor, only work at night, which means no MRI typically, no consultants, unless you really need one. Patient came in at like 3 a.m. for headaches that had been going on for 5 years, with multiple different specialists working it up, multiple imaging studies. I thought it sounded like something called cluster headaches, the management of which is just placing the patient on oxygen. Put her on oxygen and walked away. Came back like 10 minutes later and her headache was gone. I did a Tiger Woods first pump when she said she felt 100 better. Cluster headache guy here. O2 is great as a short-term abortive. Cluster headaches were an ever-present part of my life until I read a MAPS study in the early 2000s showing psilocybin showing a strong relationship between having consumed a dose and periods of remission from cluster headaches. It sounded promising, so I learned how to grow and dry them. After years trying various injections, preventatives, lifestyle changes, elimination diets, ECT, why not give it a go? Changed my life. I take 0.5 grams of dried Liberty Bell every couple months, and I never have an episode. I missed 30 days of school some years growing up, and my life, in all honesty, sucked. I wouldn't keep a gun in the house because I know how bad it can be. The only time I've had one since is when I'd, for the first time in my life, gone so long without one I didn't think to take a dose for a few months. Caught it early with O2 from my oxyacetylene torch and took my half gram the next day. I actually just figured one out. I've never been allergic to anything, never had eczema, no notable issues or problems skin-wise. That was until the end of December this last year. I started getting really dry patches on my eyelids that slowly got worse to fully red, swollen, and flaky skin that had also spread around the edges of my face. It was so painful, and I had no idea what it was. Finally got into a dermatologist, and she gave me some cream because she immediately clocked it as contact dermatitis caused by an allergic reaction. The cream helped, but whenever I stopped using it, it came back, so I went in and she told me I had to do a patch test. To make a long story shorter, my insurance fucked me and I couldn't get it then, so I had to get it sorted and then wait so long to get into another office just to get a patch test. Anyways, I finally got the patch test. The result was, I am incredibly allergic to nickel. Honestly, I wasn't too surprised because while I didn't think was allergic to it, I knew I was at least sensitive, so my jewelry is nickel-free. But my fucking glasses aren't. This whole time, the reaction has been from my damn glasses, and it's crazy to me. Thank you so much for helping her. This was literally my mom for the last 25 years. More meds and then meds to help with the side effects. My mom eventually lost her life due to her addiction to medication last year. At the time of her death, she was taking Vicodin, Valium, wearing fentanyl patches, morphine, a slew of other prescriptions. I knew she had a problem, but I didn't realize how bad it became. She lived several states away. Her room was like a small pharmacy SMH. I wish one of her doctors fought harder for her. Not a doctor, but actually a psychologist who made a life-changing diagnosis for the patient. This patient, a female of 67 years, comes into my practice one day after her physician refers her to me about having anxiety alongside vertigo that has lasted for over 12 years. The doctors couldn't figure it out, so they thought it was psychosomatic. After a brief interview, she tells me her symptoms had improved, while she visited her sister for a week and immediately got them all back when she returned to her house. I then ask her about who lives with her and tells me she lives with her son's wife, and their cat. Right there and there, I think, this isn't anxiety, but allergies. I then suggested she try moving the cat out of the house for a couple of weeks and do a deep cleaning of the house. She returns a month later, telling how she no longer feels tired all the time, her symptoms have completely disappeared, and no longer suffers from vertigo. She managed to get off her meds that she took for 12 years. All because of a cat. Gotta be honest, I felt like I'd Dr. House that thing right there. Might not be this huge medical mystery, but seeing her face after she had improved dramatically, her quality of life was worth it. TLDR lady came in suffering from vertigo and anxiety. Turns out she was just allergic to her cat for 12 years, and no one noticed until I made the connection. Local street guy presenting per EMS with medics eye-rolling, worst fake seizures I've ever seen. Handed off to me 1 hour after ED arrival. Prior team was frustrated. He wouldn't answer questions, couldn't get an IV or blood, insisting patient was being difficult, uncooperative. AMS. HR sustained over 130 in young man for over an hour. Moderate elevated BP. But that peripheral cyanosis had me at hello. That ain't right and this don't make sense. Means it's rectal temp time 108.0. Highest possible reading. Malignant hyperthermia from recreational pharmaceuticals was layer determined. Intubated, initiated rapid cooling measures. Saw the patient 3 months later. 10 degrees cooler, looking none the worse for wear.